Today, we will discuss how long-term diabetes can affect the nerves that control your heart. And we will look at how this autonomic collapse can lead to serious event like heart attack or cardiac arrest. And this basically happens when a diabetic person is under a very hot weather. That is under the sun, or you are in a place where there is no ventilation, a very humid environment. Basically, you are in an environment that the temperature is above 86 degrees Fahrenheit. And to understand how heat becomes a lethal threat to someone with diabetes, we have to look at how the condition breaks the body's natural cooling system. Because it's about cold and hot. We're talking about cold and hot here. How these two affect your body, and to the extent of affecting your nerves and result to death. That's what we're going to talk about today. And I'm not only going to be examining the cardiac autonomic collapse, but I will be explaining the biological pathways that can lead to death in extreme heat. Because we have several pathways that this can happen. So we are going to be exploring many ways the cardiac autonomic collapse can happen. So if you're ready, again, if you're just joining us, we do this every Saturday, 12 p.m. Western Time, 1 p.m. Eastern Time, and 7 p.m. African Time, West African Time. So if you want to be joining us, that is exactly the time we come on air to share information that has to do with your health, your wellness, your relationship, everything that has to do with your life, because we're talking about circle of life here, and that's what the holistic health does. So if you're just joining us, I want you to go to my page, click the plus sign, and watch the video that I pinned down to my page. Watch it, then come back, share this link, and patiently listen to what I'm going to educate today. Because it really touched my heart when I see this happening in that particular video. It's not one person, 2 people died while watching the game. So let's talk about what happened. And I'll start with cardiac autonomic collapse. What is the cause? What happened? What is exactly CAC? You see, this happens when the heat forces the heart to pump much harder to move blood to the skin's surface for cooling. Did you get that? I'm going to try as much as possible to do it, to speak slowly so that you can understand, because I really want you to get all the information you needed in this lecture. When you hear the word cardiac, you know that has to do with your heart. That is the first thing I want you to have information about. Anything cardiac, it has to do with your heart. So when you hear collapse, it means that the person actually fall to the ground. So what caused this cardiac autonomic collapse? This happened again when the heat temperature forces your heart to pump really, really hard in order to push out blood to your skin surface for cooling, to cool your body down. Let me explain what this means. You have two fluid in your body that's supposed to cool the temperature in your body. Which water is the default fluid. That is a normal fluid that cools the temperature down. The blood also support. But in this case, water is not present. Maybe it's limited. It's not much. So the blood is now serving what the water is supposed to do in your body. What that means is, instead of your heart pumping for instance, 2 gallons of blood to do its own part, while water will also do its own part. Water is no longer available now. It's not much. So the blood has no choice to supply more blood for that cooling to take place. So the heart is pumping more blood than necessary. So while doing that, it makes your heart to work so hard. And when you work so hard, you get tired. So when the heart is doing this, doing the job that is more than its capacity, it affected the heart. So I think you understand it to that level. Now, when all this happen, how it now lead to death is what we want to talk about now. You see, many people with diabetes have cardiac autonomic neuropathy, meaning their heart cannot properly adjust its rate, or you call it rhythm, under stress, under the extreme strain of heat wave. A damaged heart fails, leading to a fatal heart attack or sudden cardiac arrest, even if the person is not physically exerting themselves, exceeding themselves. When your heart has already been weakened, you pump too much of blood and it became, the heart becomes weak. It can no longer do its own functions, such as breathing, the rate, looking at your heart, because it's no longer beating as usual, as it's supposed to be, because it has already been exhausted by pumping blood to help water. And what happens when the water is not in the body? We all understand that particular period is called dehydration. The person is not drinking water, and that is why the person has no much water in the body. So when the heart now does all this and becomes so weak, he will no longer be able to pump blood. So when he's not pumping blood, you are not breathing. The rhythm will not be able to be read. You won't know whether you are breathing or whether you are inhaling. Whatever is happening with the heart will no longer take place. This is exactly what happened. Now, in summary, cardiac autonomic collapse occurs when extreme heat strains the cardiovascular system, which is your heart, causing a heart damage by diabetic neuropathy to fail, because it cannot properly regulate its rhythm or response to that stress. Now, for you to understand what actually happened here, you need to know what diabetic neuropathy is, because some people ask, what is neuropathy? Diabetic neuropathy. Diabetic neuropathy is nerve damage from diabetes. When you have prolonged high blood sugar that damaged your nerves, most often in the legs and feet, and that leads to pain, numbness, tingling, weakness, and balance issue, which can also harm other organs like heart, digestion, and urinary tract. And when CAC, let me be using CAC, when CAC happens, that is when it affects your heart. When the heart of someone with diabetic neuropathy cannot properly adjust its rhythm under stress. Now, your nerve has been damaged because the diabetes already damaged your nerves. And when your heart was trying to pump blood, where is actually going through? So it means the heat is forcing the heart to pump very harder to move blood to the skin surface for cooling, whether water supposed to be a normal body skin. Water supposed to be doing that, but now your heart is working to bring out the blood to cool your body. Water is the body skin coolant. What does your blood do? Blood is the transport system that delivers heat to be cooled by water. Now, water is not available because in this case, the body is dehydrated for staying in the sun for so long without hydrating the body. They are not drinking water. And that is why blood is being used as coolant. Now, if you are diabetic, when you are diabetic, increased blood volume happens. And what is that? On a hot day, your heart pumps significantly more blood, like 2 to 4 times per minute, to meet cooling and core circulation. That is what happens. That happens to diabetic people a lot. Yes, to meet these dual needs of cooling and core circulation, your heart pumps 2 to 4 times per minute, which is not supposed to be. So people with neuropathy diabetes, their hearts pump harder to cool down the body because blood vessel in the skin widen, is dilated to release heat, which lower blood pressure, forcing the heart to beat faster and pump more forcibly to circulate enough blood to the surface and maintain circulation to vital organs, sometimes more than 2 to 4 times more blood than normal. Now, let's take a look at factors that make it worse, that actually cause this cardiac autonomic collapse. Please go ahead and share this link. It's very important you share. A lot of people are waiting for this information. Number 1 factor is humidity. Yes, because high humidity slows sweat evaporation, making cooling less efficient and increasing cardiovascular strain. So if you are diabetic, you cannot even afford to be in a very humid environment. You should always be in a very cool area. You can no longer stay in the sun for so long, even though your body needs direct sunlight. it should be moderated, in a moderation. Number 2 factor is dehydration. Yes, sweating also causes mineral, which we call electrolyte. It causes mineral loss, reducing blood volume and making the heart work even harder. Because when you don't have enough water in your body, I just explained. I analyze it. When there is no enough water, it makes your heart pump blood. And that when it's doing that, you are making your heart work harder than necessary. And number 3 is aging condition. Older adults or people with heart or blood pressure issues like heart failure, stiff arteries, and so on, find it so hard. They find it harder for the vessel to dilate or the heart to keep up. That increased risk, of course. So this is one of the biological pathways that can lead to death when diabetic people are in extreme heat. As you can see, even this alone tells you that diabetic is not something you want to joke with. And this is one of the 4 pathways, and one of the 5 pathways I'm going to talk about today. Another biological pathway that can lead to death is heat-triggered diabetic ketoacidosis. Heat-triggered diabetic ketoacidosis. You can call it DKA. So I'm going to be using DKA. And what caused DKA? Protein called insulin breaks down and becomes dead when exposed to temperature above 86 degrees Fahrenheit, 30 degrees Celsius. So how did it lead to death now? I will tell you. If a person insulin, either in a pump or a vial, if a person insulin sits in the heat, it stops working. So if you are the type that always have your insulin here and there, and you sit so long in the heat above 86 degrees Fahrenheit, that insulin will stop working. Even if you put it on, it will not work. It will not be effective. If you are on insulin and you sit long in the sun or heat environment, humid temperature, the insulin will stop working. Why? Because without active insulin, the body cannot use sugar for energy and start burning fat for fuel instead. Fuel ni mo mean fuel. This produces ketones. This function, this that I just mentioned, it produces ketones, which turn the blood acidic. And this is DKA. Now, without immediate hospital intervention, the acidic blood poisons the internal organs, leading to a coma and death. Yeah, that's the second one. That is DKA. Now let's go to number 3. Yes. Acute hypoglycemic shock. That is when you hear hypo, that means that thing is low. Hyper is high. So hypoglycemic is low blood sugar. Do you know that if your blood sugar is low, it can also cause death? I'm sure you know that. We are familiar with a lot of things going on now. If it is high, it's dangerous. If it is low, it's dangerous. So let's talk about the low blood sugar, acute low blood sugar shock, because this is one of the pathway. And that is exactly how it leads to death. Now, what is the cause of this low blood sugar shock? Low blood sugar shock happens when heat causes vasodilation, opening of the blood vessels near the skin. I mean, when the blood vessel near the skin opens up. How does it now lead to death? When blood vessel opens up, the body absorbed injected insulin much faster than intended. And this can cause blood sugar to crash to dangerously low levels. Of course, it's going to cause the person with diabetes will die if this happens. Yes, because heat exhaustion and low blood sugar have similar symptoms. Sometimes we mix it up. You think you are having heat exhaustion, not knowing that you are having low blood sugar, because both of them have similar symptoms such as dizziness, sweating, confusion, and so on. The person may not even realize they are having hypoglycemic crisis until they lose consciousness. They won't know, because their brain or focus has been, default to high blood sugar. They are waiting. Okay, let me wait. It's going to high. It's going to high. That is what you focus on. You don't focus on whether your blood sugar can become low. That is why we are not paying attention to what's happened to us, because we are focused on high blood sugar. I mean, why both of them are both dangerous. Now, if people with diabetes are alone in the heat when this happens and cannot get sugar to boost it up, to raise their sugar, because nǹkan tó ń pààyàn náà ló tún heal èèyàn, ló ń survive èèyàn. What they tell you not to eat, they believe that can make your sugar rise, and by the time your sugar is low, they ask you to eat that particular food. This is what happens. If the person that experienced this low blood sugar cannot get sugar to raise that sugar up, the glucose up, the brain starves of energy and lead to death. That's what happened. And if you watch that video I share on my page, and I also share it on my WhatsApp broadcast, this is what happened to those two couples. I'm not sure whether they are couples. Of course, let me just use. This is what happened to those two people in that video. They became unconscious. Nobody is noticing, because they were waiting for their blood sugar to come up, to rise. They are not focusing on if their sugar can become low when they are in the sun. And this is what happened. Sometimes we need to pay attention to our body. We shouldn't focus on things going around us. Our body speaks a lot. But how often do we listen to that body when it speaks? It is no matter what you put in your mouth, no matter what touches this body, your body must speak. Whether good or bad food, whether healthy or unhealthy food, your body must speak. Must speak. when you eat certain food and you begin to have reaction, such as, itching, or rashes, headache, all those signs, it means your body is telling you that that food is not for your body. But when you eat the food and you feel good, your skin begins to look fresh, nice, no headache, no blurry vision, no itching, nothing. Your body speaks as well. It tells you that, okay, I like this food. Come on, keep on giving it to me. But how many of us listen to that body when the body speaks? We don't. And that's why we find ourselves into many health issues we are not supposed to be battling with now. Yes, I'm going to use myself as an example. Before I realized that peanut was the cause of my pimples, it took me more than 30 years to know that. I visited so many doctors, dermatologists, cosmetologists. They're just giving me pills, and I don't take pills. I don't. They're giving me creams. Nothing works. Only my gynecologists. Gynecologists take care of women's organs. He was the one that was able to tell me to change my diet. Watch what you eat. And immediately I changed my diet. Everything stopped. Everything stopped. If I show you my face about, let's say, 7 to 8 years ago, you would think it's not me. I'm telling you. But I began to listen to my body, and that what led me to nutrition career. So I'm talking of experience here. Since then, I've been listening to my body, and that took me over 30 years to realize this. If I have not been listening to my body, I don't know where I will be today. I couldn't go out. I couldn't go to the event. I couldn't party. I couldn't do anything, even though I don't really like party too much. But there's some places you want to be. I couldn't, because the way I look, there's no space in my face. I can't go now. I can go out without makeup. My face look beautiful. But before then, it was a mess. If I don't listen to my doctor, and as well take step to listen to my body and do the needful, I don't know what that could have cost me now. So that is actually an example of what I'm talking about. Pay attention to your body. Your body speaks to you. Not people around you only speak to you. Your body speaks to you. Listen to your body. All right? Now let's talk about the next one. And it's called anhidrosis. Anhidrosis. A-N-H-I. Anhidrosis. That is thermoregulatory failure. What causes anhidrosis? This is when long-term diabetes often causes autonomic neuropathy, which is damage to the nerves that control automatic function, like sweating. When nerves that control automatic functions, called sweating, is damaged, that is what we call anhidrosis. Anhidrosis. When you can no longer sweat, it means the nerves that control that particular function, the nerves that make you sweat, is dead or is damaged. If you are not sweating, go check yourself out. And how does this lead to death? In a healthy person, the brain Remember, I always tell you that whatever happens to you, whatever you do, as in this, looking, dancing, whatever, the signals comes from your brain. So in a person with, in a health, let me say the healthy person. In a healthy person, the brain tells sweat glands, the glands that control the sweating, we call it sweat glands, to release water to cool the skin. That is a normal healthy person. When it now comes to diabetic person, those nerves can no longer fire. Remember, they have neuropathy, diabetes, because nerve has been damaged. That will not happen when you have diabetes. Your nerves cannot do anything, cannot fire, cannot make you sweat much. If the body cannot sweat, it cannot release heat. And the core temperature rises rapidly to 104 degrees Fahrenheit, 40 degrees Celsius, or higher, leading to heat stroke, which causes brain to damage, of course, and multi-organ failure. So if this happens, if you are not sweating, how will this happen? If the glands that are supposed to control your sweat, and when you are sweating, you are sweating all this bacteria is out. So when this is not happening, it affects all other organs in your body, including the brain. And the last biological pathways that can lead to death when diabetic people are in extreme heat is when the fatter dehydration loop happens. Fatter dehydration loops, when it happens, that's another pathway. What actually causes this fatter dehydration loop? What is the cause? This happens when diabetic people lose fluid due to high heat, and this makes the blood more concentrated with sugar. If you don't have enough water in your body, if you are not dehydrating your body, if you are not hydrating your body, it is impossible for the organ in your body that control the sugar to control it. It makes your blood more concentrated. Instead of water diluting your blood, when you have lemon squeeze out without mixing water with that lemon, that's what I mean by concentration. It's a concentrated lemon juice. The moment you have water added to it, it becomes polluted one. I'm going to use that word. It's no longer concentrated. It's diluted. Okay? So if you are not drinking water, your water become more concentrated with sugar. Because what the kidney does is to filter your blood. When you drink a lot of water. You remember when I talked about kidney problem? I talked about this, how your kidney functions properly with the help of that water. And that is why I said water is essential. Very, very essential. Now, how does it lead to death? Let's talk about it. Now, as blood sugar rises, because it's now concentrated, the kidneys try to flush it out through urine. This creates a cycle that can result in a coma or organ failure. Either your kidney doesn't have the capacity, energy to flush out concentrated blood or something. But if your kidney is flushing out it's doing this particular function, it can become failed and the person can go in coma. Because the more you urinate, the more dehydrated you become. The more dehydrated you are, the higher your blood sugar climbs. When you drink water, you will urinate, right? Now, if you are not drinking water, you will not urinate. So the more you drink water, you urinate, the water comes out of your body, you become dehydrated. That means you need to refill. And if you are not refilling, it makes your blood sugar climbs high, lunjebe. And this can trigger a hyperglycemic state. Or you can call it hyperosmolar. Whichever one you are comfortable. They are the same. In this state, the blood becomes so thick and syrupy that it causes the brain to swell and the heart to stop. And when the heart stops, tell me what happened. When the heart stops, ikuni. Exactly. Now, here is the essential takeaway for each of the 5 lethal risks when diabetes meets extreme heat. Here is it. Number 1, it is important you know that diabetes can damage the nerves that trigger sweating. If you can sweat, your body acts like an oven with no ventilation, leading to rapid, fatal heat stroke. This is what I call hydrosis. And take home number 2 is this. It causes water loss, which makes blood sugar rise. And when that happens, high sugar then forces the kidney to pump even more water, creating a vicious circle that can result in coma or organ failure. Remember the dehydration loop, right? That is it. It is important you also know, number 3, that extreme heat kills insulin by breaking down its protein. Using dead insulin causes blood to become critically acidic, and that is what I call DKA, diabetic ketoacidosis, which is a medical emergency. Now, you need to know this number. 86 degrees Fahrenheit. It's a recommended storage temperature limit for insulin before it begins to lose effectiveness. Why? Because standard insulin starts to break down and lose its potency. It loses its potency if it stays above 86 degrees Fahrenheit for an extended period. If you don't know this, then you are hurting yourself. It must not be more than 86 degrees Fahrenheit. Yeah. And number 4, take home. If you are diabetic, note that it can open your blood vessels, causes your body to absorb insulin much faster than normal, which can lead to sudden lethal drop in blood sugar. That is often mistaken for simple heat exhaustion. You mistake, I said it earlier, you mistake that blood sugar, low blood sugar, you mistake it to exhaustion, heat exhaustion, because they both have similar symptoms. Sweating, confusion, dizziness, all those things. They have the same symptoms. So you want to pay attention to that particular 2 symptoms. 2 issues. And number 5 take home is, and which is the last one, heat forces the heart to work at maximum capacity to cool the body. But diabetic nerve damage now prevents the heart from adjusting its rhythm, leading to sudden cardiac arrest. If you don't know this, then there's a problem, because this is what I describe as cardiac autonomic collapse. I have a bonus for you, and that's what we'll call number 6. If you are diabetic, please do not walk barefoot on hot sand or pavement. Hot pavement, do not do that. It is very dangerous for a person with diabetic neuropathy to walk barefooted on hot surface or hot sand. And the reason is simple. You will not feel the burns until severe damage is done, because your damaged nerves prevent the feeling. Because that is what the function of your nerves is, to feel something. That is the function, the primary function of your nerves is to feel whatever happens when you touch your body like this. For you to know that you touch your body or somebody touch you, it means your nerves is active. The moment you don't feel it, that means your nerve is damaged. Something is wrong with your nerves. For instance, if you go to a doctor and you complain of any pain in any part of your body, especially your legs, those with arthritis, the first exam the health officer or health practitioner you visit, either nurse or doctor, will do to you is to check your nerves at that particular spot you complain. They will check your nerves. When they touch you like this, they will ask you, can you feel it? If you say yes, that means your nerve is working. If you dare say no, I can't feel it, it means something is wrong with your nerves. That they can refer you to a specialist that deal with nerves. Okay? So that is what I want you to understand. If you're diabetic and you are touching things that is hot, walking barefooted, you won't have that feelings because your nerve is damaged. I'm not saying all diabetic people with diabetes neuropathy. That's what I'm talking about. Okay? That is what I'm talking about. If you have visited your doctor, and this happens to people that have a long-term diabetes, if your diabetes has been ever, it is possible you have neuropathy diabetes. Okay? One moment. It is possible. So this message is for people with neuropathy, diabetic neuropathy. Okay? Now, how do we prevent it? That is my goal. That is what I'm concerned about. How do we prevent these occurrences, especially what's happened in that stadium? It can be prevented. But because they don't have knowledge of the information that can prevent that incident, that occurrence, that was why they buy. Now, to prevent these outcomes, I want you to remember these 4 rules. And it will do you a good if you can remember that. Number 1 rule is test. You need to check your blood sugar every 2 hours in the heat. If it happens that you cannot even avoid it to be in that heat. For instance, these people that went to the stadium, probably their kids or their cousins, their relatives, and one of the, the athletes, they have to be there to support the person. Like my son is an athlete. I don't have the ability, but I'm just saying that someone like in that situation, they cannot afford to be, they cannot afford not to be in that stadium. So if it happened that you have to be in that heat, you should be checking your blood sugar every 2 hours. It is important. You don't just sit and get carried away because somebody is, winning. No, it doesn't happen. And number 2 rules is you want to do what I call it cool. You want to keep insulin in a cooling pouch and stay in a air conditioning environment. This is very important. Your insulin, I know you go everywhere with it, especially if you are going to be in that particular place for over 2 hours. You want to go with your insulin. But make sure you keep your insulin in a cooling pouch. Pouch is like a small, let me show you. Pouch. You can have something like this, pouch or purse, where you normally keep your insulin. That is pouch. Make sure you put it in a cooling pouch and stay in a air conditioning environment. Number 3 is rules is what I call hydrate. Hydration. You need to drink water constantly, even if you don't feel thirsty. You need to drink water constantly because you need water in the sun. I wonder how people will go to a very humid and very hot environment without having their water with them. How is it possible? Even if you are not in a very hot environment, how possible you will be within 1 hour and you are not drinking? Because obviously in that video, we don't see bottled water with them. Maybe they probably have it, but they are not drinking. And the last rule I'm going to say is this. If you are diabetic and begin to feel confused and nauseous in the heat, you don't know what is actually happening. Maybe you are feeling like, what is happening here? You are confused. Or you begin to feel nauseous. You feel like vomiting. While you are in the heat, test your blood sugar immediately and move to a cool, air-conditioned area. Very important. Because you will see these signs. All these signs will come. That is the immediate priority for you. You don't just sit in a place you know that you are not feeling comfortable and you still feel comfortable. No. Because the symptoms and signs for you to feel uncomfortable is coming. You will definitely see them. So why are you still sitting down? Why are you not letting the people around you know that something is wrong with you? Yes. You need to identify it. Identifying your blood sugar level helps you determine if it is a glucose crisis or a heat crisis. Again, because cooling is necessary for both. Either heat or heat crisis or DKA, diabetic ketoacidosis, glucose crisis. You need it. You need to be in a place that is very cool. If you can be conscious of these 4 rules, trust me, there is no cause for emergency or any pain. And when I say pain, you know what I mean. Yes. I'm saying this because today, in fact, around me, I have a bunch of people with diabetes. I have them. But people will not tell you when the doctor when the doctor give them the type of diabetes they have. They just tell you, Dr. Betty, we need this supplement, we need that supplement. Of course, you know they are diabetic. You want to be very diplomatic and see what you can give them generally. But nobody is talking, nobody is speaking. They just keep to themselves. And people are sick. They're not talking. They're not. Let me tell you something. All of us, we are all sick. In this world we have today, everybody has one or two things is dealing with. It may not be diabetes. It may not be high blood pressure. It may not be cancer. Emotionally, physically, spiritually, psychologically, we are dealing with something. That is what I want you to understand. And if you are not speaking, then you are on your own. The closed mouth is a closed destiny. A lot of people die for no reason. Little thing that could have saved your life, because you were not talking, you find it so expensive to deal with. Speak out. Talk. And if you want to talk, look for professionals who can help with your particular problem. See your doctor. Any signs or symptoms you experience, tell them. Do not hide. You see, people you cannot hide for. Your doctor is one of people you cannot hide for. If you hide, you are hurting yourself. Because if you don't tell the doctor what you are experiencing, there's no way he will tell you the solution. No, it's impossible. So it is better you take this information today. Please work on it. Do as advised. And this information is not replacing any doctor's advice. You still need to see your doctor, especially when you have symptoms going on. If you see any symptoms, please hurry up and go and see your doctor. The only symptoms you will have, you don't have to see your doctor, but run to emergency immediately. I said it last week. It's when you have chest pain or shortness of breath. Run down to emergency immediately, because that means your heart is about to shut down. And if you go to your doctor will still ask you to go to the emergency. So instead of wasting time going to your doctor, sitting down on that chair, waiting to be called in before you can see your doctor, it's better you go to the emergency immediately. That is my advice. Very important. Having said that, I want you to please join me next week, where I'm going to be discussing, teaching, educating on genotype. I saw a video, and that video taught me so many things. A lot of questions were coming to my heart, and I want to discuss. I want to share it with you guys, especially young ones that are getting into marriage. You are going into relationship. There are a lot of things you need to do. Very, very important. So next week, I'm going to be talking about genotype. I mean, AA, AS, SA, whatever. I want to talk about it next week. Actually, that was what I planned to do today. That was what I planned to talk about. But unfortunately, I saw this video. This is emergency. Genotype is not emergency. This particular one, it's an emergency health issues. And that was why I changed to this to talk about it. So next week, I want you to join me so that we can talk and educate our children, including people that are still in the relationship, that are in the marriage, and they are struggling with this, dealing with this issue of genotype issues. Thousands of people have spent so much on this issue of sickle cell. We want to talk about it next week. Join me next week. I'll be more than happy to share this information with you. Till next week, I'm Dr. Betty, and here is Healthy Living, guiding you towards a stronger, healthier, and more beautiful body.